The term Aboriginal refers to a person who is of Aboriginal or Torres Strait Islander descent, who identifies as such and who is accepted as such by the community in which they live. The right to self-determination is the right to make decisions. The practical exercise of self-determination is central to Aboriginal health. It underpins cultural, community, family and individual well-being. Aboriginal self-determination and responsibility lies at the heart of Aboriginal community control in the provision of primary health care services. Contemporary Aboriginal culture is extremely diverse. It is important that Aboriginal people be given choices where possible, rather than non-Aboriginal health service staff assuming that all Aboriginal people will share the same attitudes and opinions. Whilst an understanding of kinship systems and language is important, not all Aboriginal people live within the confines of the kinship system, and some do not speak an Aboriginal language. Ask local people, especially Aboriginal staff, for advice when unsure about how to deal with issues. So that's about that culture and self-determination. But it's important to recognise that there are some people in the community that may not be from that community, but they love that. You know, they've been, they may have married someone in that community, or you know, they've just travel around and work in communities in the Northern Territory. You all no doubt know the Alma Ata Declaration, that health is the state of complete physical, mental and social well-being. It's essential. Primary health care is essential health care based on practical, scientifically sound and socially acceptable methods. It's the first level of contact of individuals, the family and community with the national health system, bringing health care as close as possible to where people live and work, and constitutes the first element of a continuing health care process. So I guess I'm leading into the role of an Aboriginal health practitioner. Now what happens is a lot of people go and work in a health centre and have no idea really what an Aboriginal health worker can do, or practitioner. So an Aboriginal health practitioner is trained in primary health care. We're not trained in acute care. So we're all about prevention, and so that's why I've mentioned that declaration. Sometimes it may mean that you're not sitting in the clinic. You might have to actually get out and go with an Aboriginal health worker to someone's house because they're not coming in, or they're not able to, things like that. So that's where that taking the health care to where people live. So some of the roles of an Aboriginal health practitioner. So they assist and advise non-Aboriginal clinical staff on community, cultural and language matters that affect the care of clients. They provide assistance and advice on clinical care of clients within his or her competency to less experienced clinical staff. They're a cultural broker. They do interpreting. They are a role model. They're chosen by the community. They used to be chosen by the community back in the days. Aboriginal health workers have been working in the Territory for over 40 years. When Aboriginal health workers were first trained, some were trained with Dr. Hargraves in microsurgery to do surgery on people with leprosy in the leper colonies in the Northern Territory. So we have some of our old Aboriginal health workers now that are still alive who have been trained in that. Bruce Herbert at Robinson River is one of them. Joe Davey is another one, who've been health workers for over 40 years and can do microsurgery. So they're the ones that get called on when someone needs their head stitched up. Also, it's generational. We have a lot of our Aboriginal health workers who are second and third generation, and it's something that it's a proud thing to do. We want to try and bring that back. We want to bring more incentives for our communities, our people to want to become Aboriginal health workers because their mother and their grandmother was. A lot of them have stories to tell, like that their mother and grandmother were traditional midwives or traditional healers. So it goes back further than just the Western medical perception of healthcare. Aboriginal health practitioners are very accountable to the community. I mentioned the national registration under APRA. to become an Aboriginal health practitioner, they used to do a basic skills certificate. Then it went on to a certificate 3. So the training has changed as the AQF came in, Australian Qualifications Framework, and now it's a certificate 4, but it takes 2 years to do. And out of the end of that, they can do most of the clinical skills that a registered nurse does, and they work alongside. And there are some health workers that actually manage health centres. They do on-call, they respond to medical emergencies, do evacuations, all that sort of thing. And they're trained to do all of that. We do have, it's not openly obvious, but there are, I'm being honest here, we do get a little bit of, who do they think they are? They only went to study for 2 years and I had to do 3 years or whatever, that sort of attitude. But when people get to realise the value of an Aboriginal health worker is not just the clinical but the cultural brokerage side of things, they realise how important they are. And all of their clinical skills, all the clinical skills we do, we don't get assessed at any lower level than anybody else. We have to know the underpinning knowledge and things like that.